Fit, active, healthy, happy, enjoying the prime of your life. Looking out for your health and wellness, this is Health Talk with Fred Lowry from Lowry Drug in Statesville. Visit Fred at his store, conveniently located on Hartness Road in Statesville.
Good afternoon. This is Fred Lowry, pharmacist and doctor of natural medicine of Lowry Drug in Statesville. And this is Health Talk, exploring the facets of your health and keeping you up to date and informed. This program is intended to share knowledge based on my experience and research. It's not intended to offer individual advice, nor does it replace a one-on-one relationship with a qualified healthcare professional. Your daily choices are yours and have more to do with your health than anyone in the healthcare field. My hopes are that this show will empower you with knowledge to take a more proactive approach to your health. Some of my sources include, but are not limited to, various news health feeds such as Epic Times, Mercola, Children's Health Defense, PubMed, and various Substack posts. The WHO in the news just ran a simulation for the next pandemic. 31 governments took part in this. Happened December the 25th. The World Health Organization coordinated this large-scale pandemic simulation. It was called Exercise Crystal, and they framed it as getting ready for the next pandemic. According to them, this simulated an emerging novel respiratory virus with the potential for international spread. Each governmental agency was asked to respond in real-time alerts, verify information, conduct risk assessments, and coordinate actions across agencies. So they looked at this as an opportunity to evaluate and refine and iron out coordination of such an event. So participants were included in terms of National Health Ministry's official response points of entry, border coordination, and government communication. They emphasized Crystal was designed to test how countries would function under an unfolding breakout and not after the fact. So this was supposed to be real-time information sharing and decision-making under pressure as an exercise. They did not describe it as a hypothetical situation, although we would think it should be, but repeatedly said it was preparation for the next pandemic. If you don't remember, there was a event 201, a similar type thing where they had pandemic practice, happened October 2019, weeks before COVID-19 was publicly identified. This event 201 was held in New York. It was an exercise organized by Johns Hopkins Center for Health Security, the World Economic Forum, and the Bill and Melinda Gates Foundation. It simulated a novel coronavirus pandemic focused on government coordination, public messaging, economic disruption, and supply chain breakdown. Like Crystal, it was presented as being fictional. So just something to be aware of. It's kind of a curious thing, although we don't know what the future will hold. One of the drug therapies that I think has had really great benefit for individuals that have various health issues is something called low-dose naltrexone. Now, naltrexone is a drug that has been used for opioid or alcohol dependency because it blocks those receptors in the brain. That dose is usually around 50 to 100 milligrams, but the low dose naltrexone is 1 to about 4.5 milligrams. So this is used for all kinds of autoimmune disorders, and we'll cover some of that. But it's really interesting because even at low doses, it apparently briefly blocks these opioid receptors in the brain and triggers the body to upregulate its own production of endorphins, the feel-good chemicals that leads to pain relief, reduced inflammation, and immune system modulation without a euphoric or addictive effect as seen in higher doses. So this is an off-label, what they call off-label drug that doctors have been prescribing for many, many years. I think we've been making it in our compounding lab maybe for over 10 years, but it's gotten more and more popular. An off-label drug prescription is using it for something that it wasn't originally intended or approved by the FDA, which, by the way, is there's quite a lot of medications that fall into that category. So the off-label conditions, chronic conditions, we've seen improvement in fibromyalgia, multiple sclerosis, various GI diseases, including Crohn's. It's been used in long COVID. It's been used in chronic fatigue syndrome, complex regional pain syndrome, and even the POTS, postural orthostatic tachycardia syndrome. That's where that when you stand up, you start to feel faint. So, and it's even been used in some cancer support situations. Pretty interesting. It also has emerged as in use in a lot of other gastrointestinal type diseases and things like autoimmune, things like thyroid, as an example. Individual creating thyroid antibodies, which is making antibodies against your thyroid. This drug we've seen success in those lab values dropping to practically nothing. So I don't know if you would call that a cure, but it's certainly a very effective approach. It has been used in irritable bowel syndrome. So apparently there was a 76% improvement in symptoms in that. Individuals with SIBO, which is small intestinal bacterial overgrowth, 75% of the patients with that showed marked to moderate improvements. Inflammatory bowel disease, 83% of adult patients with Crohn's disease experienced significant reduction in disease, 67% achieving remission. That's incredible. So it's quite an interesting approach. And if you have any of these conditions, I think it's worth looking into. It is compounded in compounding pharmacies like mine, but it's a very affordable product. Stay tuned for more health talk. Welcome back to Health Talk. This is Fred Lowry. The second product of interest today is DMSO, dimethyl sulfoxide. It is considered a solvent. It came out many years ago, early in my pharmacist career, late 70s, early 80s. It was used as a horse liniment. There was a lot of precautions about individuals using it for different things. Primarily, I think, around the fact of the purity of it. In terms of it does carry other substances into the body, and that's one of the mechanisms that it can be used for. There is a pharmaceutical product that has diclofenac and DMSO combination. So the DMSO carries the diclofenac, an anti-inflammatory, into the skin. We have used it in the compounding lab for things like toenail fungus. It carries the antifungals into the toenail. It's presented as like a lacquer that you put on the nails. It's been used to carry melatonin into the skin, all kinds of things, and there's been a lot of interest in it. You can get it over the counter. We have it at our pharmacy in a liquid, in a roll-on, and a gel. The FDA had approved it initially for interstitial cystitis as an infusion, which is interesting. But the most common use that we've seen is pain relief for joint-type conditions, osteoarthritis, rheumatoid arthritis, complex pain syndrome. It has been used in neuropathic pain, including shingles. So it has a lot of uses. There's been a lot written about it lately. There's all kinds of alternative uses for it. It's been used for wound healing. So it is something to maybe keep on your radar. They say some of the side effects may include a garlic-like breath. I can tell you that when you apply it to the skin, it has a little bit of a tingling, maybe even like burning sensation, but pretty interesting old product, if you will. I recently saw a advertisement, actually it was a commentary about animal vaccines, and it was bringing to light that there's a new canine flu vaccine made by a pharmaceutical company that is similar to the messenger RNA vaccine that we saw with the COVID, and actually this is actually a self-amplifying RNA vaccination called Novavax. Technology is very similar to the COVID shot that we had. It's billed as being adjuvant-free, preservative-free. Well, adjuvants are other additives to the product. That's not adjuvant-free, so I don't see that as being accurate. But there's also in development a 3-year RNA rabies vaccine that apparently has been approved and marketed in Canada for dogs. More application in terms of messenger RNA for Lyme's disease. I think that's questionable, and also talking about for canine cancers. Interesting enough that these COVID-19 vaccines, we've had a lot of turbo cancers, and that been speculated is tied to those. It touts a very small adverse event rate, only 2.5%. I don't think so. It's going to be more than that, but that's going to be hard to measure as well. But the point of this whole post was the potential danger to human beings and for your pet. It cited things like chimeric mutation, which means coming in contact with other viruses and mutating to create new things. I think that's certainly possible. And then the concept of shedding, which is we'll talk a little bit about that. But going back to the thing about no adjuvants, this is a product that still has those lipid nanoparticles that basically are encapsulate and protect this self-amplifying messenger or RNA. So basically what's happening is they're using a smaller material, but the concept here is that the messenger RNA will be replicating itself within the individual or the animal. And apparently they use something called the Venezuelan equine encephalitis virus as the carrier or the thing that makes itself amplifying. So that's kind of interesting. These lipid nanoparticles are all the things that we've seen in terms of polysorbates and sorbitan, cholesterol, and also there's an adjuvant that actually does have alum, which is aluminum hydroxide. So that's kind of interesting. These self-amplifying vaccines, if you call them that, can replicate inside the host cells, making more copies of itself and supposedly improving the effectiveness of it. They say it has higher antigen expression at much lower doses. So the question of the self-amplifying factor in chimeric viruses. So anytime you introduce a virus or the COVID or a cold virus or whatever, once it gets into the cell, the mechanism, it hijacks, the virus hijacks the cellular mechanism to make this genetic material. And so when that happens, it can combine with other viral particles, thereby the mutation mechanism. So these self-amplifying messenger RNAs called SAM vaccines, it's been said, can generate chimeric viruses. It says under specific laboratory conditions, but it doesn't appear to happen in living organisms. Now, that's not really logical, and it's not really something that they can measure or actually study. So you can't make the claim that it really doesn't happen, although they do make that claim. So apparently, where you have RNA recombinations of these self-amplifying viruses and circulating viruses can produce what they call chimeric alpha viruses. They say that these events are rare, but it's a theoretical thing. So it hasn't really been proven that it does, but it also hasn't been proven that it doesn't in living beings. So we get into this concept of shedding. And shedding is basically, viral shedding is a process where an infected individual releases viral particles into the environment, which is the mechanism of spreading of a virus. You get a cold, someone close to you gets a cold, enabling. So it enables the virus to spread, and it occurs after the virus is replicated inside of the host. Through body fluids, saliva, respiratory droplets, could be blood or urine or feces. So the shedding actually can occur at different stages of the illness, just before you have symptoms, during the illness, and perhaps a little bit after. Some people associate that with when the fever is happening as well. But it doesn't have to be symptomatic. So there is so many viruses we proposed in terms of the SARS-CoV-2, herpes simplex. A lot of viruses can be passed on in that manner. In particular, live virus vaccines have more potential for that, and we saw that when we had the live virus for shingles. There were individuals that got that the virus and got shingles secondary to that. So then we have another concept with this, the self-amplifying, this concept of shedding. The concept of shedding with this self-amplifying virus supposedly is not supported by mainstream scientific evidence. So I don't know how that would be different than the others. It's not a live virus, but there are particles that are being produced in the body, particles that are being excreted through and processed through normal mechanisms that the body has through excretion of some type. But if you do a literature search, you're not going to find a lot of information on that. So the current scientific consensus is that that doesn't really happen. It only happens with live viruses. Not sure that that's entirely true, but and part of that is because we've had a lot of what we call anecdotal type reports and talk with individuals that apparently have gotten sick after being exposed to an individual with a recent vaccination, particularly the COVID vaccination. So there's a lot of reports of this. So we still have to consider that it's certainly a possibility. And when they say that there's no evidence that this happens, there's still no evidence that it doesn't, and we've seen this quite a bit in terms of the way things are proposed and explained away in medicine. Stay tuned for more health talk.
Doctor, my eyes have seen the years and the slow parade of fears without crying. Now I want to understand.
Welcome back to Health Talk. Lowry Drug on Harkness Road in Statesville was established in 1959. We're a traditional family pharmacy with a state-of-the-art compounding laboratory. We offer a full line of medical equipment and supplies, including CPAP, scooters, lift chairs, oxygen. We have a full line of supplements, nutritionals, herbs, essential oils, homeopathics, and more. Come see us. So we're talking about these vaccinations that become viral factories in your body by design. Now, here's one that really caught my eye many years ago. Is a self-perpetuating vaccine. So self-perpetuating vaccines are basically that you give the vaccine to a certain number of the population, and through contact with all the people, then that vaccine, quote unquote, is spread among other individuals. There was a study done in 1999 about a self-spreading or transmissible vaccine for rabbits. This was done by an individual, and this was the only field study that I can find that's published. There may be others, but it was on Isla del Aire, which is a small Spanish island off the coast of Menorca. In 1999, They did a self-spreading test with a vaccine for rabbits. The goal was to combat two deadly rabbit diseases, rabbit hemorrhagic disease and myxomatosis. Apparently, they captured 147 rabbits, microchipped them, and vaccinated half of them with a recombinant vaccine. The vaccine combination was supposedly a harmless strain of myxoma and a virus and a gene from the rabbit hemorrhagic disease virus. The one virus spreads naturally among rabbits. So scientists hypothesized that the vaccine would spread from one vaccinated from the vaccinated to the unvaccinated rabbits through close contact. Is that shedding? That was over 25 years ago. So apparently after 32 days, 56% of the unvaccinated rabbits tested positive for antibodies to both diseases, proving the vaccination had successfully spread through the wild population. Over half of the unvaccinated rabbits tested positive for the antibodies after 32 days. This was supposedly the first and only real-world field trial of self-spreading vaccines to date that we know of course. So apparently this vaccine was never approved for widespread use. European Medicine Agency raised safety concerns, particularly around the use of one of the deadly viruses as a delivery vehicle. So it goes back to that some type of virus from one animal that's used as the mechanism and the delivery vehicle for another animal. What could possibly go wrong? There was another article in the Vaccine Reaction. Is a organization, the vaccinereaction.org, that talks about the threat of self-spreading vaccines. This was published July 4th of 2022, and it starts off with it sounds like a science fiction movie, but the NIH funded scientists have been secretly working on genetically engineered live viruses, which they refer to as contagious vaccines, and can transmit vaccine strains of viruses through the population on their own. The vaccines are so contagious that supposedly it only takes 5% of the population to receive the shot, while the other 95% would be passively vaccinated through vaccine strains, injections, shedding, and transmission. The contagious vaccines would then spread swiftly among people that come in close contact with body fluids and different secretions, sneezes, coughs, inhalation droplets, similar to the cold or flu virus. This supposedly was spurred by the COVID-19 pandemic, where researchers are looking for these types of community transmissible vaccines in the future. So keep that in mind. You know, that rabbit experiment was over 25 years ago. Do you think they've made advances in 25 years with that type of thing? So this article went on to actually talk about the study that I mentioned before. It also cited the live polio virus that infected the populations with polio vaccine strain virus. So back a number of years ago, we had the live polio virus. It was the first vaccine that public health officials used to deliberately infect the population with a vaccine strain virus as a strategy to prevent wild-type polio infections. One reason this oral poliovirus was considered superior to the inactivated poliovirus was because it passively revaccinated people coming in close contact with the recently vaccinated people. Of course, that's without their knowledge or informed consent. Recipients of this oral polio virus shed this strain of virus in the urine, the feces, saliva, and nasal secretions in the populations where it was used. And the result of this was vaccine strain polio paralysis in some individuals. It did occur in some individuals that got this oral polio intervention, and also people in close contact, such as parents changing the diapers of recently vaccinated, etc. I do remember as a child, I was got that oral polio vaccination in school. The whole school was just lined up with little sugar cubes, and everybody got vaccinated with live polio virus, which there were individuals that got polio virus from that, and also it was later found out, actually they knew it ahead of time, that it had SV40, which was simian virus 40, which is associated with the creation of cancer. Simian virus was related to the primate monkey wild viruses that were used in growing these other viruses. So that was when viruses were grown in with the use of monkeys. Pretty curious. So the U.S. actually stopped this oral polio virus apparently in 1999. Stay tuned for more health talk.
Doctor, my eyes have seen the years.
Welcome back to Health Talk. This is Fred Lowry, pharmacist and doctor of natural medicine. We were just talking about the oral polio virus and this concept of vaccine strain polio. So 1999, they switched from the oral polio virus to the inactivated, supposedly to eliminate these cases of vaccine strain polio. So vaccine-derived polio is a thing. It originates from the live weakened virus, and in cases, it says in rare occasions, it can genetically mutate during replication in the intestine of the vaccinated individuals. So this mutation form is known as circulating vaccine-derived polio. How does that happen? Is that shedding? Apparently, this type of thing caused an outbreak of polio in the U.S. in Rockland County, New York in 2022. Curious because those dates don't really match up well. But nonetheless, so we have this environmental impact also of vaccine strain polio as the virus contaminates water supplies. This happened in London in the UK, where vaccine-derived polio virus type 2 was detected, and public health officials urged everyone to be up to date on their polio vaccination. So viral fragments, I guess, found in water discovered that. So time for everybody else to go get revaccinated. In 2014, Barbara Lowe Fisher, who was the co-founder and president of this National Vaccine Information Center, great resource, by the way, National Vaccine Information Center, and executive director of this publication, referenced the report, The Emerging Risk of Live Virus and Virus Vector Vaccines, Vaccine Strain Infections, Shedding, and Transmission, which was reviewed for potential harm in the use of live vaccine and vector vaccines related to human beings and the environment. So we have that example of in '99 about the rabbit research. Apparently, there's two types of contagious wildlife vaccines. And it reminds me of the recent airdrop of all the rabies vaccine baits for animals in the wild that was exercised, I think, last year. Very curious thing. Is this the same type of program would be the question. Seems reasonable that it should be, because the amount of material that they were putting out couldn't possibly cover the entire area. So one of the types of this transferable vaccine is related to skin contact. Apparently, there is a material that can be attached to the skin with animals, and when they're grooming or have close contact, then the other animal is vaccinated. And then, of course, through the spread of breathing, touch, sexual relations, nursing, etc. So kind of a curious thing. And then you can get into the ethical implications, which at this point you have to be really skeptical about such ethics. But the ethical implications of self-spreading human vaccines. So this research on this contagious vaccines is not limited to the wild animal population. Scientists believe that they can develop self-spreading vaccines using virus or bacterial material, which can be transmitted from person to person worldwide, but not cause serious illness. That's yet to be seen. Belief systems are pretty incredible sometimes. You can believe anything you want, but it may not be true. The majority of self-spreading vaccines uses a viral vector technology similar to the technology used by the virus vector of the previous genetic type COVID-19 quote-unquote vaccinations. Scientists make a weakened form of the target virus, it could be like HIV virus, and insert the DNA into it from a more contagious but milder virus. So they're attaching, it could be attached to a cold virus or a flu virus. So this is like a carrier, one virus carrying another virus. Very fascinating. So DNA fragments from the target virus basically hitch a ride along with the more innocuous virus and spreads to the population. Scientists says that it primes the immune system to be prepared for targeted, more dangerous viruses. They have no idea what they're doing or what they're talking about at that point in time. It's almost like a clear misunderstanding of how the immune system works, which I don't pretend to completely understand it, but I do have a deep appreciation for the complexity of that. Now, this is curious. They believe that some people will die from exposure to these contagious viruses. Scientists do believe that this would happen, but the number of people that will die from the self-spreading vaccinations would be less than the number of people who die from actual infections this type of what they call secret passive vaccination is justified in that way. So, according to the United Kingdom governmental report, the spreading of vaccinations are basically less lethal than the disease. So, I guess you can justify that. But here's the problem: is concerns in terms of biosecurity is that once you start something engineered and self-transmissible in nature, you don't know what happens to it, where it'll go. Even if you just set it into the animal population, part of that genetic element, they say, might find its way back to humans. Now we're back to dog vaccinations, and the individuals that get that done to prevent any kind of virus, or in terms of like flu vaccinations for dogs. I have dogs. That just still kind of blows my mind. But if there is shedding, a lot of these are house dogs, house pets. They're in your face. Are you going to get part of that? We don't really know for sure, but there's a lot of indication here that there are a lot of pieces to this puzzle, and it has happened. So our understanding basically of infectious disease and dynamics in wildlife really remains fairly simplistic, and in terms of meaningful prediction of the outcomes with these interventions, pure speculation. So there are scientists and international security experts that are really cautious about that, saying that it's hard to predict what a contagious vaccine would do in the future because viruses are inherently unstable and frequently mutate. Of course they do. There's a concern that viruses exclusively found in certain wildlife could jump to another species or hosts as animals and humans alike. And particularly when you're using mechanisms from one species to be the carrier for another one. That's pretty much common sense. Another issue is disturbing the ecosystem where viruses and bacteria interact. So this is another potential issue. So Science Journal recently had a policy statement in which scientists warn that contagious vaccines are dangerous and difficult to manage and genetically too unstable to be used safely or with predictable outcomes, and that it's a risk here is evidence-based norm rather than opinion, according to scientists. They don't really have the evidence. And then, of course, the last thing of concern to a lot of people is these could be turned into bioweapons if they haven't already. So I think you can make the jump there related to that. So a lot of concerns there. This concept of trusting the science is certainly an issue. Particularly as we've seen vaccine theory unraveling before our eyes, and yet there's still a lot of people that believe. So stay well, take care of yourself. I hope you have a great weekend, and tune in for Health Talk next week. This is Fred Lowry, pharmacist and doctor of natural medicine from Lowry Drug. Thanks for listening.